Hi, I'm Karen Howard, Advocacy Manager at MHA, and thank you for joining today's National Policy Institute. It's a pleasure to welcome you to our program on prevention and early intervention, and we appreciate all of those who made today's event possible, including our sponsor, Kaiser Permanente. We're coming to you live from our headquarters in Alexandria, Virginia, and are broadcasting worldwide. To join the conversation online, please follow us on Facebook, Twitter, Instagram, and use the hashtags MHA Policy 2020 and before stage 4, using the number 4. I'm especially excited about today's program because it is personally meaningful as someone who experienced early childhood trauma and needed some support in high school, but did not get the help I needed until college. I also saw other peers who would have benefited from mental health services and other supports in school, but were instead directed towards the justice system. In fact, nearly 10 years is the average time between when people first experience symptoms of a mental health condition and when they get treatment. That is why we need programs like today's so that we advance policy solutions to facilitate early intervention in childhood. And why not meet students where they are, in schools and communities? Now I'd like to turn it over to Dr. Don Mordecai, National Leader for Mental Health and Wellness at Kaiser Permanente, who spent decades dedicated to the advancement of policy changes to help people with suicidality and mental health and substance use disorders. He will be followed by Congressman John Katko of New York, one of our great legislative champions, who very early in his first term took the lead on suicide prevention legislation.
Greetings. I'm Dr. Don Mordecai, National Leader for Mental Health and Wellness for Kaiser Permanente, and I want to welcome you to Mental Health America's 2020 Policy Institute. As we all manage through a global pandemic, we see the second crisis in the making, a crisis of mental health, addiction, and deaths of despair. Today's virtual event will explore how to better meet the needs of underserved youth and young adults, including those who identify as Black, Indigenous, people of color, and LGBTQ+, women during the perinatal period, and how to address healthcare payment and workforce issues. Communities of color have been bearing the brunt of COVID-19 since the pandemic began, and as multiple states across the country are seeing record-breaking spikes in cases, doctors are seeing young people of color with underlying medical conditions being hit harder by the virus than their peers. In fact, across the United States, we're seeing alarming statistics about the disproportionate toll of COVID-19 on people of color. Hispanic and Black children are much more likely to require hospitalization for COVID-19, with Hispanic children about 8 times as likely as white children to be hospitalized, while Black children are about 5 times as likely. In the city of Chicago and the state of Louisiana, Black patients account for 70% of coronavirus deaths, even though they make up roughly only a third of the population. In San Francisco, Latinx account for 15% of the population, but 25% of confirmed COVID-19 cases. These statistics alone are a clear sign that we should be concerned about the potential long-term effects this pandemic will have on children and families, especially families of color, many of whom will experience this pandemic as a long-term trauma. And this collective trauma will be reflected in the mental health of our nation. According to recent research released by the Wellbeing Trust and the Robert Graham Center, as many as 75,000 more people could die from drug or alcohol misuse and suicide as a result of the COVID-19 pandemic. The American healthcare system has historically been under-resourced for mental health, including shortages in mental health professionals, and mental health care needs have not been addressed with the same urgency as physical health care needs. However, we do see the opportunity to develop policy shifts that can help us begin to meet the great need of this second crisis. Kaiser Permanente, along with many of our partners and like-minded organizations, are working to advance mental health care for everyone, not only through the work we're doing to improve care right now, but also by building a model for mental health care based on evidence of what works, measurable outcomes, integration of emerging technologies, and breaking barriers caused by stigma. Today, we have convened experts and visionary leaders to explore the long-term effects associated with COVID-19 on youth mental health and how we can support the mental health of our youth today. The goals of today's program include sharing what we've learned about the mental health impacts of COVID-19 on youth, especially in underserved populations, lifting up current programs and initiatives that focus on early and upstream interventions, highlighting promising policy solutions, identifying opportunities for cross-sector collaboration. And now I have the pleasure of introducing Congressman John Katko, who represents New York's 24th District in the United States House of Representatives. In Congress, he serves as a member of the House Homeland Security Committee as chair of the Transportation Security Subcommittee. He also serves on the House Committee on Transportation and Infrastructure. In 2019, Representative Katko announced $2.5 million in federal funding to address the shortage of mental health professionals in schools. Over a 5-year period, this funding is bolstering on-site mental health services with an emphasis on prevention. The American Psychological Association praised Representative Katko for introducing critically needed legislation to help expand access to mental health services for the 115.4 million Americans living in geographical areas without adequate access to mental health care. Please join me in welcoming someone who is creating positive change for mental health care access in the communities he serves and across our country, Congressman John Katko.
Hello, this is Congressman John Katko. I want to thank Mental Health America for allowing me to provide opening remarks for today's event on investing in mental health prevention and early intervention services for young people. Such a critical topic. As co-chair of the Bipartisan Congressional Mental Health Caucus, I work with Republicans and Democrats daily to improve access to quality mental health care and reduce the stigma associated with seeking treatment. The current public health crisis has greatly underscored the need to advance these efforts. During the pandemic, many individuals, and especially young people, are struggling to deal with the emotional toll of increased economic uncertainty and added precautions that keep people at home. According to data from Mental Health America, over 250,000 people screened have suffered from symptoms of anxiety or depression during the pandemic. Additionally, over 42,000 people screened were positive for psychosis, with another 90,000 people experiencing thoughts of suicide or self-harm. That is terrible statistics. In addressing the public health threat posed by COVID-19, we must address the clear toll it has taken on our nation's mental health. To do this, we need to build on our efforts to expand access to telehealth, increase outreach and screening, and provide funding for mental health professionals on the front lines. I've been proud to lead efforts in Congress to provide immediate funding to mental health providers that are struggling to meet increased patient volumes while facing significant budget shortfalls. Still, more must be done, especially for students who are gearing up to return to school this fall. With new precautions in place and changing classroom dynamics, many are expecting there to be an increased need for mental health resources for students. We must act now to address the significant gaps in pediatric mental health care, which prevent students from accessing the treatment they need. That's why I'm continuing to push for my passage of my bill, the Mental Health Services for Students Act. This bipartisan legislation, which I authored and introduced with my friend and colleague, Congressman Napolitano, would fund on-site mental health services for youths in schools nationwide. I strongly believe early intervention and prevention in mental health programming is what's vital to building better futures for the many children and families whose lives are impacted by mental illness. In the coming days, I will continue fighting for bipartisan policies that increase mental illness prevention and early intervention, particularly among our youth. Thanks again to the Mental Health America for putting this forum on and allowing me to be a part of it. It's a high honor indeed. For everyone participating, I'd like to remind you, while we are all reckoning with new and unique challenges, it is important to remember that together we can and will get through this. And I will say that you are all on the front lines, and what you do every day is unbelievable. You're the angels of our society, and I want to thank you for fighting the good fight and continuing to do so. May God give you strength and give you the ability to get through these tough times and help so many people that need your help. Thank you.
Thank you, Representative Katko, for all of your tremendous work.